pleasure to introduce someone who I admire so much. She's an amazing powerhouse in so many ways. Professor Sandra Harding, AO, took up her position as the Vice Chancellor and President of James Cook University in 2007. She's an economic socialist by training and an expert in public policy in many areas, including the global tropics. And she's the convener of the State of the Tropics project. So please welcome Professor Harding.
Thank you very much, Sophie. I'll just comment too, I'm an economic sociologist, so study markets and how they work. So thank you very much for that very kind introduction, and thank you for hosting us today. We're very grateful to you. The Tropics, the 2020 report on the state of the tropics, this particular report comes out of a project on the state of the tropics, which has been in existence since 2010 when it was first conceived. This particular report and this approach to looking at global development seeks to reprise a lateral understanding of the world. So when we think of global development, we think of the world as north and south and east and west, developed, developing, Asia, the rest, of course China looms large always. But what we've lost in recent years is this lateral idea of the world, which is arguably the oldest way in which Western civilization has conceived of the world, with Aristotle more than 2,000 years ago saying that there were three zones of the world, the frigid zone, the temperate zone and the torrid zone. And he said the only place where human beings could live was in the temperate zone. But a number of us thought the tropics as a global zone with so much biodiversity and so much population, we needed to drill down and understand it rather better. And so a number of us got together and a range of different institutions, and you can see the logos and of those and brands of those institutions. A number of research institutions and universities around the world got together and decided that we would put together a report on the state of the tropics in order to map it, but also to raise awareness about this very important and vital zone of the world. So we did that starting in 2010, 2011, and in 2014 the very first report, the inaugural report, was launched. And that report was launched in Yangon by Nobel laureate Aung San Suu Kyi. And the report is a very, very interesting one even then. And as you can see, we looked at a number of different indicators. We looked at it in a range of different ways. We use data that are pre-existing, so data which are used worldwide actually for public policy development and decision making around the world. And we found in that report a number of very interesting things. And as you said quite correctly, Sophie, at that time there were many opportunities revealed in the tropics, but also many challenges. So one of the nice things that happened as a result of that particular report in 2014, on the 29th of June, was that the UN General Assembly, and I'm very proud to say Australia led the push on this, and 74 nations of the world joined Australia to co-sponsor, at that time, to co-sponsor a resolution to declare 29th of June the UN-endorsed International Day of the Tropics. And we had that declared, and it was a remarkable thing, and it was passed in the General Assembly without dissent. And so every year now on the Tropics Day, International Day of the Tropics, we try to do something special, but this year is more special than most because what we're doing is releasing that next broad brush report, which is following up on the 2014 report to ask that same question: is life in the tropics getting better? What is different and what is the same? And what I will do, as you indicated, is provide a snapshot of some of the more important aspects of the report as an overview, and we can discuss some of those later. And it's a mixed report card again. It's a mixed report card because there has been progress, and that's fantastic. But there also are many challenges, and I think like many others, we're very concerned about what COVID-19 is going to mean for the tropics going forward. So first, to look at the people of the tropics, it is a very youthful population still. And indeed, our estimates still remain that by about 2050, it's going to be more than half of the world's population, and fully 2/3 of the world's children will live in the tropics. It's extraordinary. Right now, it's about 52% of the world's children under 15 live in the tropics. It's about 42% or thereabouts of the overall population. And that's called a demographic dividend, and that provides enormous opportunity but great challenge we might explore later on. In terms of education, again, there's some good news here. The mean years of schooling, the average schooling, has increased throughout the world and in the tropics, and the gap between the tropics and the rest of the world has changed very little. For every 7 girls that finish high school, 10 boys finish high school. So there's a gendered effect here as well. Fortunately, youth literacy has improved, and that's going very well. And adult literacy has improved as well, up into the 80% right now. In terms of poverty, globally, extreme poverty has fallen consistently since the early 1990s, but progress has slowed since 2014 and since the early 2000, with people living in extreme poverty in the tropics declining by only 1 percentage point since the last report. Now, that's largely due to ongoing and resurfacing conflict around the world. So the total number of people living in poverty in the tropics increased slightly between 2014 and 2019. Since the publication of the 2014 report, maternal and child health has continued to improve, but progress in the tropics has unfortunately been slower than in the rest of the world, particularly since 2010. And there are a number of global hotspots which really account for more than half of all the world's maternal deaths and early child deaths as well. In terms of wealth and economics, and as we know, part of the challenge for us going forward is as we move from a health emergency to an economic emergency, how are the tropics going to cope with that? What we know is that gross domestic product per capita has continued to increase globally following the global financial crisis of 2008-2009. But the gap between the tropics and the rest of the world has grown larger, indicating that economic growth in the tropics is not keeping pace with global growth. And that's really very important, and it goes to a point that you raised, Sophie, at the outset around debt servicing. So what we're seeing, unfortunately, is a significant increase against the last report in the tropics, and that's a warning sign of future debt challenges for the tropics, even as they are looking to deal with that health emergency and coming through the back of what is certain to be an economic emergency there too. Diversity, a part of what's wonderful about the tropics, that zone of the world between the Tropic of Cancer and the Tropic of Capricorn, is that it contains about 80% of the world's biodiversity. It's a remarkable proportion. It also contains the majority, the greatest proportion of the number of threatened species. And unfortunately, some of that continues with the effects of climate change, in particular, those narrow ecological ranges within which organisms live have narrowed further still, and that's created some great difficulties for parts of the tropics, but there's good news here too. Forest loss has actually come off, so it's not as great, forest isn't being lost as much as it was in the past, as great a rate as in the past. It's slowed, but it still continues, and so of course we're concerned about that. More protected areas have been declared though since 2010, and more than 20% of all land areas in the tropics are now protected. There are cross-cutting issues, and I just mentioned one. Climate change is very important, and we know that climate change effects are going to be felt far earlier and more robustly in the tropics, and that is because tropical organisms live in that very narrow ecological range, and so they don't have very far to go. They're not as tolerant as temperature changes and climate changes overall, and we know that that's an enormous problem. And we know it's a problem health-wise too, with a growing distribution of arboviruses such as dengue and Zika, and that's related to climate and to urbanisation as well. Conflict continues to be a problem in the world, and that too is preventing and slowing the rate of progress in the tropics, as you might imagine. Criminal violence is also occurring, and that leads to poor social and environmental outcomes, rising undernourishment, and allowing extreme poverty to persist. And there are other external factors too that are driving challenges from outside the region. So when the rest of the world suffers, as it has in this particular pandemic and this crisis, the demand that is driving some economic development in the tropics has also weakened, of course, and that's having a very difficult effect on those populations. Migration has reduced, the level of remittances coming back to developing nations has reduced as well, and that's putting additional pressure on those economies. So the impact of COVID-19, we begin to speculate, and at this stage it is only speculation around what those impacts might be, and I'm sure we'll get to some of those with Professor Hotez and in our own discussion. But we know that this is going to be a challenge, particularly in those areas where we already feature undernourishment and high levels of poverty, where there are already strained health systems and a high burden of both infectious disease and non-communicable diseases, so diabetes, cardiovascular diseases, which are also developing at a great rate in the tropics too. And of course, those widespread economic effects affecting the rest of the world and consumption are going to affect the tropics. And part of what we're concerned about is those parts of the tropics that are highly reliant on tourism, for example, are most likely going to look to rely on generating income in other ways, and some of those other ways might end up with further environmental destruction and further poor outcomes for populations as well. So in terms of a conclusion for us, is life getting better? Certainly, it is a mixed report card. Life is getting better in the tropics by and large across a number of key indicators. However, progress has slowed in a number of areas, and that's of concern, particularly going into this economic emergency. And as we can imagine, COVID-19 will have some effects. But we don't change our mind about the importance, however. That's the we being those involved in this very important global project. The future depends on the tropics in no small way, and that's because that's where most of the people are going to be. That's where a lot of economic vitality is going to be drawn from, and we need to make sure that those challenges are addressed, but the opportunities that exist in the tropics also are developed and managed to the advantage of those communities. Global recovery must draw on that lateral view of the world, in our view, and include the tropics, because tropics is going to be a key driver of economic development going forward. Thank you, Sophie.
Thank you. Thank you so much, Professor Hiding, for your insight, and you certainly have illuminated from the report that there are some challenges, but also some opportunities there, which we can unpack a little bit more. Now, we want to hear some questions from the audience, so we'd like you to ask questions as well. So if you do have a question that we can get to in a little while, please write it in the chat box. So we will be taking questions in a little while, and we would love to hear what you want to know about as well. Now, we have two special guests who are joining us via video. I would like to introduce our first guest, Barka Dutt. So she's a well-known Indian television journalist. She's an author and she has a YouTube channel, which is very popular, called Mojo. And I'm highly jealous of the fact that she has on Twitter, she has 7.2 million followers on Twitter. So she's extremely influential. And when she talks about India and the world, people listen. And you might have seen Barka in a recent episode on ABC of Foreign Correspondent, where she showed our reporters what she was doing, going around India, really documenting what was happening there with the COVID-19 pandemic. And she's recorded a special video for us for this event to celebrate the launch of the State of the Tropics 2020 report. So let's go to that video now.
Well, I think before India had to deal with the coronavirus pandemic, this national lockdown, the world's largest lockdown of 1.3 billion people now entering almost its third month, there was a sense that while there were chinks in the armor of the Indian economy, and certainly unemployment was, for example, a huge challenge, there was a sense that India was this powerful emerging economy, this powerful emerging superpower, and despite warts and all, India would secure its place on the global stage. There was definitely that sense. But I think what the pandemic has done, and you can't disassociate the pandemic from the lockdown, what it's done is it's wrenched open many of India's societal inequities, many of India's class divides. It's held up a mirror to social prejudices, to entrenched elitism, and it's also exposed the gaps in our healthcare infrastructure, which has for example, lower than the WHO prescribed doctors per patient ratio that is needed, which has much fewer beds, critical care beds than per patient than is needed. So I guess where I would come in on this is to say that one, it has opened existing inequities, showing, bearing them open, leaving us almost stripped naked for all of us to look at ourselves in the mirror. And the second dimension, of course, has been that it has had lethal consequences for the economy that I think India is still coming to terms with. So to that extent, we're mirroring what's happening in a lot of other countries, with the caveat that we are a very big country, we are a poorer country compared to many of the countries that have had to deal with this virus. We're a diverse country, and no one size fits formula really applies to us. So I think we're grappling with a whole lot of things that we did not have to contend with before the coronavirus pandemic struck us. About 3 months ago, when I decided that I was not going to sit inside a studio or sit inside my office or sit inside my home and report this pandemic, in fact, I knew that it was virtually impossible. I thought that I was setting out to report the story of a medical emergency. But when I started moving out instead, and to 13 different Indian states, literally the length and breadth of the country, what I discovered was that actually I was reporting on a humanitarian crisis that may in fact be bigger than explain what I mean. In every country, of course, social inequities have played out. So, for example, even in Western countries, poorer people or people of color have had to deal with this pandemic in a different way than, for example, those who are well off or who are white. Similarly, if you apply this experience to India, I found that the poorest Indian citizen was in effect paying the price to keep the middle class and the upper middle class in lockdown. And I remember meeting this woman in a slum tenement in Bombay, and she worked as a domestic help in many of the high-rise, swish, swanky apartment buildings of Bombay, India's financial capital. But of course, the people who employed her had refused to let her come into work. They thought she may carry the virus from the tenement that she lived in. Many of them were mean enough to stop paying her wages. And she said this one thing to me, and she said, "Isn't it ironic?" She said in Hindi, that the virus came in on an aeroplane. It was brought into India by the relatively rich, but it is the poor of India who are on the streets. It is the poor of India who are paying the price to keep the rich safe. In another city, I met a 9-year-old child, and I was just playfully asking him. He was the son of a migrant worker. Migrant workers are the millions of Indians who've suffered the most in this pandemic. They're basically people whose homes are in the village, but who are daily wagers who work in the city. And we saw the largest mass exodus of these workers, millions of people walking the highways, men, women, children, barefoot sometimes, in the blazing heat, sometimes through the desolation of the night. And there was one such 9-year-old child of a migrant worker, and I asked this child, "Do you know what the coronavirus is? Do you know what COVID-19 is?" And I was just being playful with this child. And the child turned around and told me, "Yes, I know what coronavirus means. It means I do not get food to eat." This was a little child's understanding of what this pandemic is and what's happened in India. And that's what I discovered about my country. All of these class divides were sitting under my nose, but because I have all my life been a political journalist and a conflict reporter, these were not stories I covered. I thought this was the soft stuff. I thought this was the stuff that belonged to feature reporters. And I had to unlearn a lot of my own assumptions about media, about my country, about society, because basically I discovered that this is an existential divide that exists in my country, and people like myself have been ignoring it. People like myself have been looking the other way from it because it simply made me too uncomfortable, and people like me too uncomfortable. And what this has taught me, this whole experience of being out on the road literally for 100+ days, is that there is no looking away. There is a moral pressure on the collective conscience of this country that there is no escaping from anymore. Me optimistic right now in the middle of this very, very grim time is that for reasons that haven't been medically understood, the fatalities level of India, the fatalities rate, which is how many people are actually dying from this virus, remains quite low in India when compared to other countries. Scientists have been trying to understand this phenomenon because that infection rate is definitely rising. We are also, unlike other countries, seeing many people between 40 and 55 more hit than even sometimes about people above 65 or younger children. So we're proving to be an outlier medically, and that slight silver lining in these clouds is what I think everybody is holding on to. The fact that not as many people have died in this country as a percentage of the infection rate as have in other countries. There have been explanations offered ranging from India's demographics make it a much younger country, to the fact that we're a hardier country. We've had exposure to zoonotic viruses before, so maybe our herd immunity is actually higher, at least in terms of this virus not killing as many of us. But that aside, I have to confess that I feel with a sense of dread that the worst may lie ahead, that we may yet be away from a peak, that it may explode over the horizon when we least expected, just as we're beginning to unlock, just as we're beginning to get people back to work, just as we're beginning to get the traffic back on the streets. And our hospital system, is still reeling from the pressure on it. And the problem really is not beds, because like other countries, we have set up giant facilities where there are beds. There just aren't enough health workers to man these beds, right? So there are doctors, nurses, ward staff in acutely short supply. Many of the facilities are asking for volunteers. And India is fighting a dual battle. On the one hand, the worst of this pandemic, I don't think, is over. And on the other hand, you have this mass humanitarian crisis that has unfolded. You've had millions of workers leave the city, go back to their villages. Once they're back in the villages, and I followed them back to their villages as well, it's not that once they're back there, they have any source of income, they have any food to put on the table. Our economy has been severely hit. And I should mention that we are at a very, very tenuous position with China. Alongside this pandemic, we have had Chinese incursions into Indian territory. Join the dots. What connects this virus and what's happening at our borders with China is of course, China. The fact that in the middle of a pandemic, India may be looking possibly at a limited border conflict with a country like China, which has chosen this moment, perhaps sensing India's social vulnerability, to send its troops into Indian territory, creates a brand new challenge when India can least afford it. So if you ask me, am I optimistic? Other than the fatalities rate, no. I think it's going to be a period of turmoil. It's going to be a period of conflict. It's going to be a period perhaps of social strife if we do not manage our inequalities. And it could even be a period of strategic conflict. There is optimistic is not the word I'd use, but this is a resilient country. It's a country that knows how to fight. So hopefully we'll fight our way through it. So I'd only like to say that I think we haven't even begun to understand the magnitude of what's unfolding in India. There will be research done on vaccines, on which drugs work, and whether we can contain this pandemic. But in terms of the social crises that I really have a sense is going to erupt upon us, we haven't even begun, for example, talking of millions of Indian children that could find themselves pushed out of the school system. The class divide there, because children in the cities or children who have access to internet data can take part in school, but there are children, the internet access in India, in rural India, is 15% compared to 42% in urban India. So for everyone who's working in international organizations, for everybody who's working in academia, it's very important to go beyond the pandemic and make the people the focus, make the children the focus, to also turn a gendered lens on this pandemic. Women are not just 50% of the front line of doctors and nurses, but they're also inordinate pressure on women right now, managing homes, managing jobs, managing their children, managing their partners, often stepping back from access to even food. They will make everyone in the home eat before they will eat. So I think for me, the next step of research should really be on women and children. We have experiences from Ebola, for example, that tell us that maternal mortality increased after the pandemic. And I really do worry what's going to happen to poorer women and children in India. So I think that would be something for those in academia, for those in research, to turn their attention on.
Wow, thank you, Baka Dad. I wish I could tell her in person how thankful we were for getting that insight and really bringing it home, the powerful impact that COVID-19 is having in a country like India. Her reporting's been amazing, to take out on the streets to really get a first-hand look at what's happening on the streets of India. So we really appreciate her taking the time to make that video for us today. So now we have a special second video we're going to play for you. And this is a video from the African Union for Development CEO, Dr. Ibrahim Asane Miyaki. So let's play that video now.
Excellencies, honorable guests and delegates, ladies and gentlemen, first of all, I would like to express my sincere appreciation to Professor Sandra Harding, Vice Chancellor and President of James Cook University, for her leadership in conducting the State of the Tropics 2020 report to its successful completion, which is the good reason for our today gathering. I would also like to recognize Ambassador Dr. Charles Murigande, Deputy Vice Chancellor for Institutional Advancement, University of Rwanda, for initiating the involvement of the African Union Development Agency, AUDA NEPAD, thus the African Union and its member states. I also take this opportunity to commend all the experts and support staff that contributed to the realization of this important report. Secondly, I would like to state that all the above efforts fit very well within the ideals of the African Union Agenda 2063, which is our continental common vision to build an Africa that is prosperous and peaceful, while, among others, ensuring effective and territorial planning and land tenure, use and management systems. This preoccupation is also premised in the United Nations 2030 Agenda for Sustainable Development Goal 15, which commits to protect, restore, and promote sustainable use of terrestrial ecosystems, sustainably manage forests, combat desertification, and halt and reverse land degradation. The African Union Development Agency, NEPAD, was honored and privileged to contribute to this 2020 State of the Tropics report on various topics, including African countries' efforts to restore their degraded lands and forests, like the African Forest Landscape Restoration AFR 100, with the main objectives to reach food security and sovereignty through an increased local agricultural production. And then COVID-19 hit the planet, which is certainly the reason to have the launch of this important report virtually. In terms of response to the current pandemic, and despite being affected much later and at a relatively lower rate, the African Union and its member states have reacted in a vigorous and coordinated manner. At the continental level, the African Union Commission, through its Center for Disease Control, developed a continent-wide strategy with two overarching goals of: one, preventing severe illness and death from COVID-19 infection in member states, and two, minimizing social disruption and economic consequences of COVID-19 outbreaks. Such actions envisage that the Africa CDC coordinates the efforts of member states, African Union agencies, World Health Organizations, and other partners to ensure synergy and minimize duplication. At the same time, it promotes evidence-based public health practice for surveillance, prevention, diagnosis, treatment, and control of COVID-19. Also, at the continental level, the African Union has acted swiftly to establish a coronavirus fund with commitments already totaling more than $30 million. At the national level, most African countries have implemented lockdowns, testing of suspected cases, and contact tracing. The downside of lockdowns, as you know, is that if they are prolonged, is their negative impact on social and economic activities. In poor and populous communities, prolonged lockdowns are a ready trigger for social unrest. Therefore, AUDA NEPAD short-term response and support to member states is situated in the context of slowing down the pandemic, knowing more about how COVID-19 is spreading, and lessening the socio-economic impact. Lower numbers of confirmed cases in Africa are, however, worrying, paradoxically, because they do not help us to understand the scale of a COVID-19 outbreak, which means the actual total number of COVID-19 cases. Except for South Africa, the rate of change of confirmed cases is also lower. So the question is, are we doing enough tests to get the overall picture? What if the pandemic takes a turn for the worst on the continent during the impending winter season? To some, the threats and damages caused by the COVID-19 pandemic that the world is currently experiencing are also lifetime opportunities to plan and implement policies and measures that will help build more resilient and robust societies and economies. Indeed, the disruption in which the coronavirus outbreak has brought to the entire world could also be seen as a perfect opportunity for a global rehearsal for other gradually looming threats to life and livelihoods, such as climate change, water scarcity, desertification and land degradation, loss of biodiversity, current and future diseases. In light of the above-listed threats and also opportunities, the view of the African Union Development Agency and other actors in Africa is that a special emphasis must be put on supporting and empowering smallholder farmers who represent nearly 80% of the continent's agricultural production. They must be recognized as a driving force, not only in the current fight against the COVID-19 pandemic, but also well beyond in building stronger and more sustainable food systems. Strengthening and integrating national and regional food systems is therefore critical in eradicating food insecurity and malnutrition in our continent. Achieving these objectives will go through the implementation of appropriate tools and policy instruments to address the variety of risks related to agriculture and food insecurity. Excellencies, ladies and gentlemen, I cannot stress enough the importance of this State of the Tropics report, especially in the challenging period the whole world is currently in. Indeed, it is apparent that the world is facing various complex challenges. These challenges are interconnected, and some of them do affect most of us, as these challenges know no geographical border, like climate change, pandemics, etc. And holistic efforts, such as this report, will not only contribute to think and act in an inclusive and sustainable manner by putting to the welfare and well-being of people and ecosystems worldwide at the center of this reflection. In conclusion, I'm convinced that this crucial and collaborative work will trigger several opportunities and partnerships which will lead to concrete actions to be implemented in tropical regions of the world. Thank you for your kind attention.
Thank you very much, Dr. Miyake. Thank you very much, Dr. Miyake, for your contribution as well. We really appreciate it. We'd now like to welcome our special guest for an important conversation. Professor Peter Hotez is the co-director of the Texas Children's Hospital Center for Vaccine Development, the professor and dean of the National School of Tropical Medicine at Baylor College of Medicine. And he's based in Houston, Texas, and he's been one of the leading voices in the United States on COVID-19. So much so that we only have him for about 15 minutes. I think he's in demand, and CNN wants to talk to him as well this morning. So we're going to talk about the State of the Tropics report, and then we'll sneak in a few quick questions about COVID-19. Don't forget, if you have your own questions, please write them in the chat box. And we're delighted to welcome Professor Hotez, and I'm glad to see that he's wearing his trademark bow tie. So welcome, Peter.
Thank you very much. I'm sorry that things got a bit rushed. We're in the middle of a COVID-19 crisis here in Houston. We're seeing a dramatic acceleration in the number of cases, and patients are coming into our hospitals. And this is happening across the major metropolitan areas of Texas and Arizona. So I'll only be able to hang out a few minutes, unfortunately. I deeply apologize.
No, we understand. We'll ask you a couple of quick questions about
It makes the State of the Tropics all the more relevant. I'll just say a few words to begin. One is just echoing the other comments. I agree there has been a slowing or even a halting of gains starting in 2015. And I have a new book coming out at the beginning of next year called Preventing the Next Pandemic, Vaccine Diplomacy in an Age of Anti-Science. And it starts out saying, since 2000, extraordinary growth and progress, mass treatment of neglected tropical diseases, incredibly successful, our incredible success in vaccinating the world's children, dramatic declines in measles, and pertussis deaths and other vaccine preventable diseases, heading towards elimination of lymphatic filariasis, maybe river blindness, trachoma, yaws, and scabies, and a lot of the scabies leadership, of course, has come out of Australia, as well as some of the other neglected tropical disease work. I always like to point out that Australia's science always punches above its weight in terms of its ability to do important things. But then I make the case that things have slowed, and they've slowed for some of the things that we're discussing now, mostly social determinants, but also climate change. And while people talk a lot about climate change, what we've been finding, it's not climate change in isolation, it's climate change happening in concert with these other social forces like war, political collapse, urbanization, deforestation, and now this very aggressive rise in anti-science activities. And it has been happening in specific hotspots, such as the Middle East. We've seen this very dramatic rise because of the conflict in the Arabian Peninsula, in Yemen, in Syria, and Iraq. We've seen it in Venezuela with the collapse of the socio-economy there. People have stopped vaccinating, and a very significant rise in malaria and other neglected tropical diseases. And there we're starting to see also, as this has also been associated with lots of human migrations and contact with Yanomami, indigenous people, Wayuu indigenous people. So indigenous people are getting hit especially hard with these reversals. And I think that we could do a whole hour just talking about that. Even in Texas and the Gulf Coast with climate change and anti-science in parts of sub-Saharan Africa, Boko Haram occupied northern Nigeria and parts of the DR Congo, and Philippines and elsewhere. And this is starting to unravel some of our gains. And that was bad enough. And then, of course, COVID-19 hit. And now we are seeing this very steep acceleration. And what we're seeing in the US is COVID-19 is emerging as very much a health disparity, disproportionately striking low-income neighborhoods, where it was just pointed out in India, the same forces in the United States, more difficult to do social distancing, higher rates of diabetes and hypertension among the poor, and this sort of confluence of neglected tropical diseases with non-communicable diseases as well, producing this terrible synergy, diabetes with dengue, diabetes with COVID-19. This is going to become an important new theme. And although COVID-19 is not really being portrayed this way, with a few authors, we wrote this piece, is COVID-19 the next neglected tropical disease? And we make the case that yes, we think it is when we see this racing through the favelas of Fortaleza and Belém and Manaus in Brazil, in Delhi. And I think these will be pretty awful in parts of India and Bangladesh. So as terrible as things have been since January, I say this could just be the beginning, and it's giving me pause for great concern. What do we do about it? Clearly, global governance is so important. The United States leaving World Health Organization is disastrous, and many of us have been working very hard to try to fix that and prevent it from happening. Also, the urgent need around global governance for vaccines. We're trying to accelerate a COVID-19 vaccine specific for global health with India, a low-cost recombinant protein vaccine expressed in yeast, the same technology used to make the recombinant hepatitis B vaccine, and it's made locally in India, Brazil, Cuba, Bangladesh, Indonesia. So we hope this could become the first global health COVID-19 vaccine. It's clear that business as usual is not working for us. We will need a new level of attention to the tropics, and this is why this report is so timely and important. This will only become a more important theme as we head through the next decade of the century. So I'll stop there, maybe take one or two questions, and then again, deeply apologize for having to.
Oh, no, we understand. I was just going to ask you, how do you feel about the response of tropical countries to the pandemic and some of the differences in that response? For example, Vietnam versus Brazil and the way they've coped with the pandemic.
Well, tremendous variability, isn't it, and heterogeneity, and we still don't understand a lot of things about this virus and why some countries seem to be getting hit very hard, others less so. I mean, clearly, governance is huge. We're finding that authoritarian, ideologically driven governments don't do well with this virus. I mean, there's no coincidence. It's not a coincidence that the three countries most affected by COVID-19 are the United States, Brazil, and Russia. And whereas very pragmatic, non-ideological driven governments seem to do pretty well, or at least better. And exactly why that is, I think, is something that has to be looked at. And again, this interface between political science and traditional biomedical sciences is going to be very important. And one of the conclusions of my book is we have to have this uncomfortable and unprecedented dialogue between the different fields of human study. We have to bring political scientists, sociologists, economists, anthropologists, and people who study the humanities in the same room as the biochemists and the virologists and the microbiologists. And even though people are going to sit like this, not really talking for the first few minutes, eventually it'll warm up and we'll realize this is what we have to do to solve complex multidimensional problems.
So I watched an interview with you where you said that after SARS, the first SARS and MERS, that the world, really should have been more prepared for this. Is that the case, that we should have been prepared and we should have realized that something like COVID-19 was coming and it was only really a matter of time?
Oh, absolutely. We knew, we picked up this coronavirus program a decade ago because we'd already seen SARS, we'd already seen MERS, and it's just been a matter of time before we saw the next one. And it would just be a matter of time before we see COVID-22 and COVID-26. And so that's going to be our new normal. Each time there's a terrible epidemic or pandemic, we always say now this is the one that will fix things. And things have gotten better. Since after SARS-1, we had IHR 2005, International Health Regulations 2005. And then after MERS, the Global Health Security Agenda, and then now Ebola in 2014, which was an extraordinary response where we vaccinated 200,000 people with a new vaccine under the most horrific circumstances you can imagine that averted a humanitarian crisis in Africa. So things have unquestionably improved. I'm sorry, the Ebola was first in 2014, but in DR Congo in 2016. I'm sorry, this year. So things have improved, but, and we learn with each pandemic and epidemic, and we will learn things from this one, but our learning curve has to be steeper, unfortunately.
And you mentioned the vaccine. So how concerned are you, though, that if there is a vaccine that does become available, even one that may not be 100% effective, that it will actually be able to be rolled out to the countries in the tropics who obviously will need it just as much as countries in other parts of the world?
Yes, and then unfortunately I'm going to have to go. Well, I'm very worried. I am not optimistic that, although everyone talks about global access and we keep on signing out to documents saying we're committed to this, I'm not so convinced. And so this is why we've, because some of the technologies are new, this is why we just went ahead and created this great partnership with PATH that led the development of the malaria vaccine for Africa, the meningococcal vaccine, to accelerate the development of a low-cost pick yeast expressed recombinant protein COVID-19 vaccine. And hopefully the others will happen as well.
Well, thank you very much, Professor Hotez. We know we know you're in
demand.
Thank you,
and apologies for not hanging out.
You're in demand, and look, best of luck with everything, and particularly in Texas where you are, where we know it's particularly difficult. So we really appreciate your time this morning. It's been a valuable insight. We really appreciate you making the time for this important.
Thank you so much, and congratulations on all your successes and congratulations on the report.
Thanks very much. So I might pick up now with Professor Harding just on some of the other points that we wanted to cover. One of the things we were interested in asking you is, what are your thoughts about the future for countries in the tropics with the advent of COVID-19? What additional challenges does this pose? I mean, Bakadat alluded to quite a few of them. You know, that this poses particular challenges, this pandemic, for countries who are in the tropics, doesn't it?
Look, it absolutely does. And in a way, you could look at this in two ways. The report, of course, is based on data that was gathered pre-pandemic. And so what we do in the report is we basically begin to speculate about where the effects might be. But as we've heard from a number of our speakers, it's fairly plain that communities that are already undernourished, that already have strained health systems, that already are highly, there's high inequality, for example. We know that those, you know, and Baka was talking about this, we can expect the impact to be greater there. We already know from the rest of the world, looking at the United States right now, that women too are disproportionately affected. And as we know, even here in Australia, part of what we're talking about is the impact on women in terms of the economic emergency and unemployment going forward. Now, that's happening here with all the sorts of beneficial governance supports that we get. One can only imagine what's happening there. So when I said you can think about this two ways, the data that we gathered, therefore, are very much, you know, pre-pandemic, and we do need to therefore speculate, and I can speculate as much as anybody on these matters. But what's great about it is that we now have a very firm benchmark for the tropics. So our ambition will be, in the next couple of years, to do a follow-up report, particularly on the impact of the pandemic, because we have this benchmark. We don't have that for the rest of the world in a way that we have it for the tropics. So we should be able to drill down and not then have to wonder what the impact is and whether or not, for example, the, you know, the impacts are the same or different than the rest of the world. We'll actually be able to find that out. I guess the other comment that I'd make is that wherever, as well as extreme poverty and undernourishment, wherever you have conglomerations of people in urban environments, plainly that's been a great challenge. And because, as we show in this report, urbanisation has increased greatly from about 30% of the population in the tropics being urbanised to about 47% in the matter of only a few years, and that can be expected to grow further for all sorts of appropriate reasons. What we know and what we fear really is that that urbanisation is proceeding unbothered by any planning or provision of utilities or services to provide support for those populations so that they can work and live and simply be in a community where they have access to the services that they need, that mean that they're going to be less less congested, I suppose, too. Congested. I think about the favelas of Brazil, for example. Less congested communities, and even, you know, looking at Barker's earlier reports on aspects in Delhi and people living, you know, cheek by jowl as they can and do in various parts of the world. That has got to be a place where greater transmission can occur. So to the extent to which this urbanisation has increased markedly, there would be an argument that the tropics is actually more exposed now than it would have been 5 years ago. And to the extent to which urbanisation continues, there's a continuing argument that that is likely to continue to play out in those environments. And then I'm thinking about what Peter Hotez said. You know, we should expect pandemic 2022. If that's the case, really now is the time for us to begin to think about how do we manage tropical infrastructure differently. And one of the case studies we've got, actually there are a couple that go to this. The African Union's case study is fantastic, and it does look at the cooperation that Dr. Mayaki described in respect of Ebola and how that's helping now, one can only imagine. But another one which goes to public housing and the need for appropriate public housing for all sorts of health and economic effects, public transport, economic effects to enhance the chances of economic prosperity.
So one of the things we're going to be wrapping up in a few minutes, but I thought, Professor Harding, just to end on, we might talk about, as you've mentioned to me, that Australia is the developed country with the largest tropical land mass, and we know, as a country, we know how to do business in the tropics. How underutilised do you think this skill base and this knowledge is, and how could we use it to help the countries of the tropics more effectively than we are maybe at the moment?
I think that our knowledge and our know-how, our business know-how, is absolutely fundamentally underutilised. What we know from an earlier report, and again confirmed here through those urbanisation figures, is that there is a great demand for sustainable infrastructure in the tropics. And this is absolutely required, and a number of the large organisations like the World Bank, for example, the IFC and others too, have looked to see where they can place their investment to enhance development. The IMF, how they could support tropical communities. And we know that this infrastructure lag is incredibly important. So we know how to build bridges in the tropics. We know how to build roads in the tropics. We know how to deliver health services in rural, remote and Indigenous communities. We know how to deliver education. We know how to do these things, and from my point of view, there is an enormous opportunity for us in the north of Australia to partner with the tropics. The reason why we haven't done it to date, I think, has been that we haven't thought of ourselves as being in the tropics. You know, we've tended to look south. You know, we've seen ourselves as a temperate sort of place. But the fact of the matter is, we are the developed country with the largest tropical landmass. We have universities and research institutions, our CSIRO, AIMS, for example, in marine sciences, all have technology and know-how. Our business community is fundamentally equipped to meet this challenge, and it is there for us to meet, and we should do it. The future does depend on the tropics, and it depends on us and our ability to work with and for the peoples of the tropics, I think, for these beneficial purposes.
Well, look, thank you so much, Professor Harding, for your insight, and I would just really implore everyone who's watching to go through this report, look at this amazing and really important data that's been collected, and to share the findings of this report with all your networks and all your colleagues, because it's really very illuminating, and it's a roadmap to where we've come from, but also points to where this important region might be going in the future. So I'll just hand back to you now, Professor Harding, to do a couple of acknowledgements for today, but thank you everyone for watching, and over to you, Professor Harding.
Thank you very much, Sophie. And yes, I would simply like to acknowledge Anne Penny, who is the project manager for the State of the Tropics report, without whose orchestration this simply could not have happened. And Anne has been working with the project now for a number of years and does an extraordinary job. And today too, this wouldn't have happened without Anne. But we've had a number of contributing authors that you can see there on the screen right now, and also advice and assistance and reviews from around the world. And I just want to do a big shout out to all of those who've contributed. The State of the Tropic report is not a slimline version. It is a very significant report which anyone can access, www.stateofthetropics.org. Go there, you'll be able to see a range of different tools and data, as well as the latest report itself and the presentation that was provided today. So thank you for the opportunity again to Sophie to acknowledge those very important people without whom the report simply wouldn't have happened. Thank you very much.
Thanks, Professor Hiding, and thank you for watching. Thank you very much.